This morning, I want to talk about the medications and the diagnosis that the VA gives you, and then the spinal cord stimulator, the Burst DR spinal cord stimulator that the VA is using right now. Um, the I want you to be aware that if you're a veteran or your loved one is a veteran and he goes to the VA, to double check um, the medication he's taking, make sure that there's no major drug interactions, and if there is, that the doctor is aware of these interactions. I've been given medications that should not go together, like cyclobenzaprine, a muscle relaxer, and amitriptyline for my stomach. In low doses, it's used for IBS, and then also on top of that is Cymbalta. They use all generic names most of the time, so you might not know the actual name. Like Cymbalta is like it starts with a D. It's it's weird, but my concern is that it can have some adverse health reactions, and just double check the medications that you're taking. The Burst DR spinal cord stimulator that I had implanted and then explanted this year did nothing to help with my pain. I shouldn't have even had that put in. I shouldn't have never even passed the psych eval with Abbott or St. Jude Medical that created the Burst DR spinal cord stimulator. Um, the the doctor, the neurosurgeon I saw him about 3 times, and then I got the trial for the stimulator. And the neurosurgeons, you see them for like 3 or 4 minutes tops. They're really quick, and they have tons of patience. And so, if you have the Burst DR implant, um, watch the new device documentary on Netflix. I don't know the name of it. I forgot it. I watched about 20 minutes of it and I couldn't watch any more. But um, there also is a group on Facebook called Failed Spinal Cord Stimulators. Great support group. If your spinal cord stimulator is not working, they talk about their experiences on Facebook. Um, Also, um, the diagnosis. Okay, the diagnosis, like I went to a neurologist. My second neurosurgeon said, well, you need to go see an orthopedic surgeon and a neurologist for MS. So he thought I had MS. Well, I went to out of state to see a neurologist, about 500 miles to see a neurologist at another VA. And he says, well, I think it's just, fibromyalgia and your anxiety. I said, okay, but let's do a brain MRI just in case. And I think it's been just about 6 or 7 months, and I haven't done the MRI yet of the brain. I have it scheduled, or about to have it scheduled for the second time. The first time, I didn't do it because I was afraid when I had the spinal cord stimulator and that it would mess me up. Well, thankfully, that I didn't go. I did not do the MRI of my brain, and I'm thankful I didn't go. I just had this intuition not to do it. So I'm getting another appointment set to do that, to rule out MS or a TBI. And if you have the Burst DR, make sure that it works. Don't leave it in. If it doesn't work, get it out. There's no reason to keep it in. They spent almost about $450,000 getting a Burst DR implant, with all the fees and the imaging. And then on top of that, my personal experience, I was in ICU for 5 days afterwards, and that bill came up to $750,000, because the neurosurgeon, he rushed through the surgery. The hospital released me, discharged me with an active spinal cord fluid leak, and it was just ridiculous. I had a terrible experience with that hospital, and I sent them a demand letter, and so now they got a super lawyer defending them, and we'll see how that goes. I don't know if I'm going to get a lawyer on my part or just wait for the response or whatever. And again, double check your medications, double check your diagnosis. Like I was saying, the neurologist, I went and saw a second neurologist, and he diagnosed me with polyneuropathy, especially small fiber neuropathy, because I lost sensation in my feet and my hands. And I have all these weird symptoms from coming back from Iraq. It's just really weird. And but I went and I just fired my orthopedic surgeon. I don't mess around when it comes to healthcare. If they're taking their time or they're trying to milk the choice program, I don't I don't need you. Like you want they will not be a part of my healthcare team. I don't care who it is. I will just not. You're fired. I'm not going to get the choice program. You're not going to milk the choice program. You're not going to. You know, there's it's just too, they only have so much money. And so actually I fired him today or yesterday. I did. And we're looking for another surgeon. And I see a lot of doctors scared to prescribe opiates now, or you have to choose between the two, between an opiate and a benzodiazepine, which I'm on both, but I've weaned off benzodiazepines, and I just started the regimen of hydrocodone about a month and a half ago through the orthopedic surgeon, and of course I was paying for it out of pocket. So when I saw this PCP for the first time where I'm at, I told him, and he was like, "Well, I'm going to make sure you get a 30-day supply of this medication from now on, so that way I'm not paying $100 a month for my pain medication." I said, "Okay." Well, I get home and Saturday, I look up, I'm up at night, and on Saturday, I noticed he put in all the medications besides this medication. So, I wrote them through secured messaging. So if you don't have My Healthy Vet, get My Healthy Vet. And anything you do with the VA, all right, do it through the security messaging so that way it's in your files. They can't delete it, or whatever. I also record my phone calls. Like it's just an automatic recorder. And if I feel to, I save it, because I've had doctors lie to me about my MRI. I've had like just this case. I was in his office. He told me he was going to give me the medication, and he didn't, And finally, he actually ordered it today. I saw him on Friday. It's Monday, or yesterday was Monday, so he ordered it yesterday. I guess he apparently did not put that one in, but he had put on every other medication he put in for me. And I've been fighting like crazy not to go with Big Pharma. Big Pharma's making so much money, but I'm getting tired of being in pain. And it's just like my panic attacks. I needed that medication to stop me from having a panic attack. It's a crazy feeling. You think you're going to die. You end up in the ER with a high heart rate, and you can't breathe. You're sweating. And so that's why I try to refrain from even going out into the public or even going into Walmart, going into the mall. I do on occasions, but it's mentally hard for me. Um, I went to the Houston Zoo, and I just had a terrible experience. And but just double check your medications, double check your diagnosis. Don't be afraid to get a second opinion. If you have Medicare, use it. Pay that $30. That usually it takes for the fee. Once your deductible is met. But get a second opinion from most of the diagnoses that the VA gives you. Double check the medication that they give you too as well. Don't just take it. Like I was told in the other video, the older generation, they don't get second guess their doctor. Get a second opinion. It is for your health. Your peace of mind is to get a second opinion. And if they don't come to the same conclusion, or the same answer, get a third opinion, and then you choose what needs to happen. It's your body, it's your health. You do what you think is necessary for you to have a good quality of life. And that's it. That's my topic for today. Is overlook your medication, look it over, uh, research it, make sure there's no major drug interactions, and if there is, that you know about it, or your spouse knows about it, or your son knows about it, your daughter, whatever. Double check the medication the VA gives you, because it can bring hell on your life, for sure, for sure. And anyways, that's all I got for this morning. I'm gonna get out of here and do some other things, but y'all have a good day. Bye bye.